Hello, followers. Good morning, good afternoon, good evening, wherever you may find yourself, depending on your time zone. This is Angelina, Ange for short. I am your 21st century virtual nurse. So when you call me by that name, I will simply respond, Hello, how are you doing? Let's talk about menstruation or period as we popularly call it. You know, another name for menstruation, it's called anti-rose. Menstruation, aka anti-rose. So we're going to talk about preparing our child or our children for menstruation. We need to prepare them before they menstruate. So menstruation, when does it typically begin? Menstruation typically begins at about 12 years, but periods are possible as early as 8. It typically begins at 12, but these days, a lot of the children are menstruated early as 8 years old. Some of them are having their period. So that's why it's important to discuss this topic early with them. It's important to discuss it earlier before they start. Even though menstruation can be an awkward subject to explain, do your best to prepare your child for it and do your best to prepare it, even though it's maybe an awkward or embarrassing topic to discuss with them, especially for your children. So talk early and often with them. The earlier you begin talking to your child about the changes to expect during puberty, the better. Don't plan a single tell all discussion. Don't just sit them down one day and talk about it. Tell all. Instead, plan a series of conversation. Let it be a series of conversation here and there. Don't do it at once. If your child asks questions about menstruation, please answer them openly and honestly. Don't hide anything away from them. Mothers, please, let's try as much as possible to be open and honest with our children if they ask us. But if they don't ask, it's up to you to start talking about it. If they ask, be honest. But if they don't, is you have to find a way to start talking to them, because whether you like it or not, they're going to menstruate, and it's better to inform them, let them know what to expect and how to keep themselves when they menstruate before it starts, so they will know, they will be prepared psychologically, physically, and emotionally prepared, because it could be, it can be a very what do I say, a very awkward moment in their life. So how do you start? You might start by asking what your child knows about puberty. Ask them question. Begin by asking them if they've heard anything about menstruation, or if they know what they know about puberty. Clarify any misinformation. If you ask them and they tell you something and they are misinformed, please try and clarify them. Ask if your child has questions and explain the basics. Okay, if ask them if they have questions and explain the basics. Share your experiences. You've been through the stage before of puberty, so share your experience with them. That's why you need to be open and honest. I used to have very bad menstrual cramps. I told my daughter. She doesn't have it. Luckily for her, she doesn't have it. But I open up and talk to her about what to expect, just in case. And then after you share the experiences, follow up on any health lessons and sex education your child is receiving in school. They teach them these things in school, but you have to do your part as a mother to follow up with whatever lessons on sex education that they are being taught at school. Sometimes your child may resist to talk to you, but don't give up. If they resist, don't give up. Your child needs to know the fact about the menstrual cycle and all the changes that puberty brings. They need to know the fact about menstrual cycle. When I started doing this Facebook page, I think that was my first video on February February 19th or 20th, one of those days, between 19th to 22nd or so. I did a video on menstrual cycle. It's still over there. So if you want more information about the menstrual cycle, please go back and check my video on menstrual cycle. So you need to talk to them about the changes that puberty brings. Because if you don't do that, their friends might provide inaccurate information for them. Talking to your child can help eliminate unfounded fears or anxiety, as well as positively influence your child's body image. Talking to them will help influence their body image and then eliminate any unfounded fears or anxiety. If their friends who have had their menses tell them, oh, it's very painful, you're going to feel bloated on yada 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 yada, and you reassure them that not everybody experience that, and even if you it happens, I am there as a mother to support you. It will lay any anxiety or fears that they will be having. So it's important to talk to them. Also, the conversation you have with your child about menstruation can lay the groundwork for future talks about dating and sexuality. So, if you open up to them and talk to them about menstruation, it will open up for you to be able to talk to them about other topics like dating and their sexuality they as the conversation go along, because the channel of communication will be open. And please remember not to be judgmental or condescending, because when they sense if your child sense any ounce of judgmental, they will close the communication channel. You won't be able to you might talk to them, but they won't open up and talk to you. Teenagers can be very funny in brackets. They have a mind of their own sometimes. So be open and come to their level if you really want to get through to them. That's how it works. Your child might want to know when it's going to happen, when she's going to start her period, what it's going to feel like to have your period, and then what to do when the time comes. So if you look at these pictures, for instance, we use the red flowers. That's why we call it, and when I was in secondary school, we used to call it Auntie Rose. When I started secondary school and the first day I had Auntie Rose, I'm like, my grandmom is Auntie Rose. Auntie Rose is not here. Somebody said, oh, Auntie Rose has just visited me. So I was like, who is Auntie Rose? You had a visitor? And it was funny, but we referred to period as Auntie Rose because of the color of rose, the rose flowers. So when preparing your child, you have to teach them the practicality of menstruation, how to take care of themselves. This is tampon. We insert this and then the thread over there stays outside. So when it's time to change, you just pull it and then it comes out. And others also use the pad. When the time we had a period, we didn't have these beautiful pad. We were using cotton wool to do it. Now things have changed. This is much better. It holds it, and then you don't feel wet, the wetness. And period can be very, very painful. You can it can produce cramps, not for everybody, but this is a picture to show how painful it could be. The cramps with periodic cramps. It's like a burning sensation. This is a picture just to show. So if your daughter asks you what is menstruation, tell them menstruation means their body is physically capable of becoming pregnant. When you menstruate, your body is physically ready to capable of becoming pregnant, but it doesn't mean they should go and get themselves pregnant. This is where you need to teach them about their menstrual cycle, so they will be well informed. Please don't think that teaching your daughter about menstrual cycle means it's a license to for them to go and have sex. You just have to empower them with information so they will know the consequences of their action if they decide to do anything. Okay, it's very important. If your child asks you when will it happen, well, nobody can tell exactly when a first period will occur. Well, okay. Typically, however, menstruation begins about 2 years after begin to develop. So your breast will develop first before you menstruate. And then if they ask you how long does it last, you will tell them the first few periods will be light with only a few spots of blood occurring. And then most periods last from 3 to 5 days. And then 3 to 5 days, but anywhere from 2 to 7 days is normal. Two is the shortest time it can happen, but sometimes it does. And then they might ask you if it's hurt. The common symptoms include cramps, like this picture here, includes cramps. You might feel dizzy. You might have nausea and diarrhea, which is possible. And then when it happens, exercise, have a warm bath, a heating pad, or an over the counter pain reliever can help ease the discomfort. So this is the like pain, abdominal cramps, nausea and vomiting can occur. The cramps comes with bloating as well. Some people may feel bloated, like this picture here. Okay, so educate them, like let them know prepare them for all these. Like I said, my daughter, I I taught her about all these, but luckily for her, she doesn't have what I experienced before I started giving birth. The pain can be it can be debilitating sometimes. You can't do nothing. It's so painful, and it causes nausea, vomiting, dizziness. Mine was worse on the second and fourth day. I had to take medication sometimes. And then don't let your child suffer in pain. Give them something like medication. Over the counter medication helps. And then see, this is so much pain, she can't even sit straight. It happens when you are in so much pain. No position is comfortable. Teach them about their menstrual cycle. Okay, it's very, very important. And teaching your child about their menstrual cycle isn't a license for them to go and have sex. It's just an empowerment, and then they have to know when their cycle begins and ends, so they won't mess up themselves when they go out. It's very important. This is a, a warm water bottle that you boil water and cover it well. You put it over there. It helps relieve the pain and the cramps. Yes, let me, before I go on, those people living with house helpers, please do them a favor. If you have a young lady living with you, teenager as a house help, every month make sure you treat her well like you would treat your own daughter. We overwork them, and we most of the time we don't treat people house helpers well with empathy. Let's be empathetic at least a few days in a month. Let them rest, give them a break, and treat them well. Whatever you do for your daughter, please do the same for them. They are also human beings. They go through all this pain and everything. I can imagine if I were somebody's house helper, and I had to go through what I went through every month, and then I have to work on top of it. That would have been, I don't know how I would have done. And I know people are going through that, but who is there to speak on their behalf? Please, if you have a teenager or a young lady living with you, every month when they are in their cycle, give them a break, please. Give them a break and let them relax. They also need to rest. Again, your child would like to know what they should do. Please explain to them how to use sanitary pads, tampons, and menstrual cups, and the importance of changing them regularly, at least every 8 every 8 to 12 hours. 12 hours is even a long time. At least every 8 hours they have to change it. It's very important, so they won't attract any bacterial infection over there. They won't breed bacteria down there. And stock their bathroom with various types of sanitary products ahead of time, like Dettol. It's very important, so they won't have any bad smell. And then encourage them to experiment to find a product that works best for them. Like I showed it earlier on, tampon, and let me see. This is tampon and pad, and the pads are very these days. You see the wings over there. You wrap it at the bottom of the underwear so it holds it. It doesn't move while when you walk or run, and it doesn't break into two as well. And changing it regularly, like I would even say every 6 hours. It's better to change it every 6 hours. 12 hours is too long, depending on how heavy your flow is. Some people bleed heavily, others not so much. So you know yourself, and then you change it accordingly. They will another question they would your child might ask you is, well, everyone know that I have my period, because it's awkward, an awkward feeling, especially those of us who went to boarding house and miss school with boys. You don't, when it comes, you don't want anybody them to have a hint that you have your period, because you feel embarrassed. When your child asks you if everybody would know they have their period, explain that pads, tampons, and menstrual cups aren't visible through clothing. Explain to them nobody will see it through their clothing. So encourage your child to carry supplies in a backpack, purse, or locker, just in case they need to change themselves, so they won't soil their clothing. Okay, they need to change carry they need to change regularly, and then also carry the tampons or pad or menstrual cup, whatever they use with them, some of them with them. So if the need arises for them to change, they will change it on time to avoid soiling themselves, which can cause embarrassment to them. And also, if your child is worried about when their friend's period began, tell them everybody is different, and everybody is different with their cycle and flow. So they shouldn't worry about their friends' menstrual cycle or compare it with theirs. Let them know everybody's own is different. And also tell them it's common for them to have irregular periods. For instance, it might take 6 years or more after their first period starts for their cycle to become regular. It might be regular initially, and it might take 6 years, as per the research I did, for their period to become regular. And the menstrual cycle, let them know the average menstrual cycle lasts 28 days, not the flow, the cycle. It lasts 28 days. And then teach them how to track their periods on a calendar by using a smartphone so that they won't forget. If like it's 3 days to the time, they will have their supplies, extra supplies in their bags or locker at school, or like something with them. So if the need arises, they will have something to use. It's very important so they won't mess themselves up. It is suggested that you schedule a medical checkup if your child hasn't started menstruating by age 15 or within 3 years of the start of breast growth, or breast hasn't started to grow by age 13. So it is suggested you make an appointment to see a doctor. And then also when the she goes 3 months without a period after beginning menstruation, or you suspect pregnancy. Also, if she has periods that occur more frequently every 21 days or less frequently than 45 days. So if she has frequent menstruation every 21 days, or she doesn't have it after 45 days, she hasn't had a period, it's continuous, please take the child to the hospital, your teen to the hospital. Another reason to take them to the hospital if they have periods that become irregular after having been regular. For instance, if their periods is every 28 days and now it's become so irregular, this month they have it, the next month they don't have it, take them to the hospital to see a doctor. And if their periods last more than 7 days, it also calls for a bit of concern. If they have severe pain during their period, or they bleed in between after they've done their period, once in a while they bleed spontaneously, take them to the hospital. And also, if they having their period and the bleeding is more heavily than usual, or they are using more than one pad or tampon every 1 to 2 hours, they have to change. It's too much. It's considered too much. The bleeding is considered too much. So take them to see a doctor. And during their menses, if they suddenly have a fever and feel sick after using a tampon, sometimes not everybody body accept the tampon. This is the tampon. So if they use it and they have sudden fever, they develop sudden fever and feel sick, please take them to see the doctor. Okay, it's not a good sign. All these pictures I'm just showing to let you see the pain that people go through. This is the warm water bottle. This lady cannot do anything. It's so painful when you don't want to hear anybody speak to you, and all you want to do is to lay down, curl yourself like this, and lay at in a quiet, dark place. You don't even want to see any light. So, in conclusion, I will say, be positive, encourage your child, talk to them, and know that the changes associated with puberty can be a little scary. So reassure your child that it's normal to feel apprehensive about menstruating, but it's nothing to be too worried about, and assure them that you are there to support and answer any questions they may have. This is where I will end here. Remember, the page name is Angie Talks. We are also active now with on YouTube. It's Angie Talks One TV. Please go and like and subscribe the YouTube page as well. Thank you so much. Have a lovely day, everyone. Bye.